So you can tell I'm a lawyer because I often start my talks by saying that I'm just speaking in my own personal capacity. I'm not speaking for the Oregon Psilocybin Advisory Board or any of my employers. So getting that out of the way, I come at this from the perspective of medicine and public health. I'm a law professor, but I did train to be a doctor. And like Dr. Sackett and probably many other people on this panel, I was very frustrated by the limits of our mental health care system. The drug treatments we have are often very ineffective. They haven't changed very much in decades. Up to 2/3 of people who take an SSRI like Prozac, Paxil, Lexapro receive an inadequate benefit. And oftentimes people will take multiple drugs over the course of many months or many years and still receive no benefit or inadequate relief. So due in part to their ineffectiveness, we've seen suicide rates rising steadily for the past 20 years. We've seen drug overdoses literally skyrocket in the same time, the past 2 decades. So people want and need something new, something different, and psychedelics or entheogens do appear in many cases to fill that unmet need. They often have fewer side effects. They often act more quickly, and really impressively, and no one really understands why this is, the benefits often persist for months, sometimes 6 months or more. And the evidence suggests that they are relatively safe. And that's especially true of psilocybin. It's very non-toxic. It has a very low potential for addiction. People just don't use these substances the way they might other more addictive substances. And many prescription medications, even many over-the-counter medicines, are more addictive and more dangerous. Some psychedelics like psilocybin appear to help people overcome addictions to substances like alcohol, tobacco, and opioids, which collectively are responsible for over 500,000 deaths every year in the US. It's actually closer to 750,000 deaths. And Seattle has certainly been affected by these trends. And it's really important to note that we're talking about decriminalization here. We're not talking about legalization. We're not talking about retail sales. And we're really just advocating to not arrest people and put them in prison when they have few options and they try to help themselves. Last week, I was talking to Jesse Gould, who's a former Army Ranger, and he runs an organization called the Heroic Hearts Project. And they set up psychedelic retreats for veterans who will travel to a retreat in another country to use a psychedelic like ayahuasca. And he told me that he thought it was tragic that in America and in Seattle, people who've made such incredible sacrifices for their country are forced to either violate the law or to bear the expense and burden of traveling to another country to gain access to these substances which can help them. Decriminalization is a very sensible, evidence-based policy at this point. It's been implemented in other countries around the world and in a growing number of cities and states here in the US, including Oregon. I really commend you, Councilmember Lewis, for your leadership on this issue. Many veterans thank you, many people with cancer, substance use conditions, disabilities, and mental health conditions thank you.